Welcome to week 3, where we'll cover chapter 2, Principles of Physical Fitness. So after reading this chapter, you should be able to identify physical activity recommendations, physical fitness components, explain the goal and the basic principle of physical training, able to design a well-rounded exercise program, and the steps for making it safe, effective, and successful. So almost any kind of physical activity promotes health. So short periods of intense exercise do not compensate for hours of inactivity. So if you are studying for 10 hours, try to get up and move at least once an hour. Physical activity and exercise are points along a continuum. So here we have death rate for all causes, and we have sedentary and extremely active. So as you can see, it starts at 0.6 and not at 0, just because we can't 100% say that if you're extremely active, you won't die from anything. This is just talking about your longevity possibilities. So if you're sedentary, so you are just sitting all day doing nothing, you have a higher risk of death in comparison to somebody who is extremely active or even moderately active would be right here. So let's talk about the difference between physical activity and exercise. So we call it a lot of the times PA for physical activity. This is just any movement of your body in comparison to exercise, which is planned, structured, and repetitive. Physical activity is essential to health, and it really provides a wide range of health benefits, but exercise is necessary to significantly improve physical fitness. As I've talked about it before, we are recommended 150 minutes of moderate intensity exercise and 75 minutes of vigorous intensity exercise. Increasing the volume and intensity adds just additional health benefits. And it is recommended that adults people in their 40s and up should do muscle strengthening activities, because as we age, we lose our muscle. And doing those activities really helps sustain that muscle. And everybody should avoid inactivity. Physical activity really helps everybody, no matter your age, and no matter what type of group you belong, and also people with disabilities. Moderate physical activity uses about 150 calories of energy and causes noticeable increase in heart rate. We won't really go into the calorie count. Here we're talking about vigorous physical activity. So this is rapid breathing and your heart rate is increasing. This is important in understanding when the difference is between moderate versus vigorous. So any 10 minutes of any type of movement does count toward your 150 minutes if it's just moderate intensity, or towards your 75 minutes if you are running at a very increased level for 10 minutes per day. So these are some common activities and sporting activities, and we're talking about the duration that we are required, and then also if it's less vigorous, it takes more time to reach the 150 minute requirement versus something that is more vigorous. So for example, you're washing your windows or floors at home, takes about 45 to 60 minutes to burn 150 calories in comparison to somebody who is running a mile and a half. It just takes 15 minutes. So your intensity definitely determines how much you're burning. Moderate intensity activity usually burns 3.5 to 7 calories per minute in comparison to vigorous intensity activity, 7 calories per minute. As you can see, there are different activities that are listed here. For example, hiking, at leisurely pace, or kayaking, whitewater rafting. So there's different types of activities, but you can always, in most of these, increase moderate intensity activity into vigorous intensity activity. Increasing physical activity to manage weight. 2/3 of Americans are overweight, and the US Department of Health and Human Services has published guidelines focusing on weight management. So 150 minutes to 300 minutes per week is not enough to really lose weight in comparison to 90 minutes per day of physical activity is supposedly is the thing that will help you manage and lose weight. People exercise to improve physical fitness, so you can obtain greater health and wellness benefits by increasing the duration and intensity of physical activity. So you start going to the gym more often and you are doing more reps. Physical fitness requires more intense movement that possesses a substantially greater challenge to the body. So there is different recommendations for whatever goal you might have. If you're just thinking of a general health goal, you need to do the 150 minutes or 75 minutes per week. Increased health benefits, you need 300 minutes per week of moderate intensity or 150 minutes per week of vigorous intensity. So if you're trying to maintain weight loss, you should exercise 60 to 90 minutes per day. And muscle strength and endurance, you will have to do different sets of reps, including weight training that helps gain resistance. Also, as we age, flexibility is important, so you need to perform a full range of motion exercises 2 to 3 days a week to make sure that you're keeping your flexibility. Neuromuscular training, so older adults should do balance training at least 2 to 3 days per week. For example, yoga, Tai Chi, balance exercises. And these are exercises beneficial for young, middle-aged adults as well. We will go into further neuromuscular training. So how much physical activity is enough? Regular physical activity, regardless of intensity, makes you healthier and can protect you from chronic diseases. Fit people have more energy and better body control, and they live a more active lifestyle. Some physical activity is better than none. So if you have a week where you just cannot possibly go exercise, as long as you're walking instead of taking the bus, it's better for you. So health-related fitness, we have cardiorespiratory endurance, muscle strength, muscular endurance, flexibility, and body composition that we will talk in greater detail. So first, let's start with cardiorespiratory endurance. This is the ability of the body to perform prolonged, large muscle dynamic exercises that are at moderate to high levels of intensity. This is where it is depending on your lungs to deliver oxygen. And if you took KIN 173 or you're about to take KIN 173, you will talk in greater detail about how important oxygen is for your cardiorespiratory endurance. Muscle strength, the ability of muscles to exert force in a single maximum effort. We also have relative strength, so the maximum force exerted relative to the body weight, body size, and muscle size. Greater muscle mass means higher rate of metabolism, and this is vital process which processes your food and nutrients and produces that energy. Muscular endurance is the ability of muscles to remain contracting or contracted for long periods of time. Muscle endurance is important for good posture and injury prevention. So for somebody who doesn't work on muscle endurance and they break their leg, it will be much longer for them to recover in comparison to somebody who does muscle endurance exercises. Flexibility, as we talked before, it's important to do full ranges of motion for flexibility. And this also depends on joint structure, length, elasticity of connective tissue, nervous system activity. Inactivity causes the joint to become stiffer with age, and we lose a lot of our flexibility as we age. So it's very important for you to always try to move once you are in your 60s or whatever, because you will lose that range of motion and you won't be able to turn around fast or whatever it is that you're not utilizing. Body comp. So this is fat and fat-free mass. So fat-free mass is your skeletal muscles, bones, and water in comparison to just fat. We talk about, oh, my fat mass is 30 or 7%, 7% or to 5% is like Olympic athlete fat mass, and 30 or so for adults that are female is completely fine. So it really differs between males and females and at what age. Person type, so it is your body classifications. So predominantly muscular is called mesomorph, tall and thin, ectomorph, and round and heavy endomorph. Neuromuscular, skill or related fitness. These are very important for sports and competing athletes. So this is your reaction time, your movement time, your ability to coordinate the rest of your body as fast as possible. Principle of physical training, adaptation to stress. So we want to teach our body to adapt to the stressors that we are that occur during our day. So adaptation is your physiological changes that occur with exercise training. Short-term adjustment lead to long-term changes. So even if you're able to work for a little bit, that's better than none. Physical training, you are performing different types of activities that causes the body to adapt and improve its level of fitness. So this is where they encourage you to exercise different parts of the body and do different types of activities, even though it's not related to your sport. Specificity is the training principle that develops a particular fitness component requires performing exercise specifically designed for that component. So if I am a swimmer, swimming more as my training will help me in my swimming competitions in comparison to somebody who is a swimmer and about to compete and they're doing yoga or playing basketball. That really won't help them in the pool because they need to practice specifically those different strokes that they're going to perform. But of course, if you're not a athlete, a well-rounded exercise is encouraged so that way you're working on all parts of the body. Progressive overload is another important concept, and this is where the training principle that progressively increasing amount of stress on the body causes adaptation to improve fitness. So the amount of new activity added above a person's usual level is known as overload. So you want to do it progressively. You don't want to be the person who is always a swimmer and now is running a marathon in a month. You want to gradually adjust to that. Now we're going to talk about the FIT principle. Now they have added the VP as part of the FIT principle, and this is important for your group presentations. So FIT stands for frequency, how often should you perform that exercise, intensity, how hard and how fast, time, how long, type, the mode of activity, and the VP is the volume, so how much frequency / intensity / time, and progression, how a program advances over time. So reversibility is very important thing. So if you're not exercising like you used to for about 2 months, you lose 50% of every type of neuromuscular adaptation or any type of adjustment that you have done in 2 months, 50%, and you won't get it back until you restart the program. Of course, there's individual differences and limits of adaptability. People respond to training at different rates. Specific genes influence body fat, strength, and endurance. However, physical training improves fitness regardless of your genes. Design your own exercise program. So getting medical clearance, making sure that there's a risk from death and the exercise is small. People of any age who are not at high risk for serious health problems can safely exercise. The PAR-Q, if you ever come in for exercise and somebody gives you a PAR-Q, they're just trying to evaluate, are you ready to exercise? Physicians may recommend exercise stress test or graded exercise test to determine if the person might have heart problems when exercising. So of course, assess yourself, your current level of fitness, and the 5 health-related fitness components. Setting goals. Ultimately, you want to be always active throughout your life, so that way you maintain your muscles and your full range of motion. You also want to have a balanced program. So if you are only a swimmer or only a marathoner, you want to not burn out. So maybe doing yoga or Tai Chi occasionally will help you be motivated for whatever your goals are. Physical activity pyramid, so sedentary activities. This is where you're not moving at all. Strength training, 2 to 3 non-consecutive days per week. Flexibility training, cardiorespiratory endurance, 3 to 5 days per week, 20 to 60 minutes per day. So this includes walking, jogging, bicycling, swimming, or any other aerobic activity. Moderate intense physical activity is 100 to 300 minutes per week. For weight loss or prevention, it should be 60 to 90 minutes per day. So ACSM is the body that recommends all of these things. So we want frequency of training. You need to do 5 days per week of moderate intensity exercise and at least 3 days per week of vigorous intensity exercise, as we have talked before. Intensity of training, so 55 to 65 to 90% of maximum heart rate, or 40 to 50 at 85% heart rate reserve. And all of this we will talk in greater lectures next lecture. So I won't go into it too much time. And so this is the duration, 20 to 60 total minutes per day of continuous or intermittent aerobic activity type. So what type of activity you're working on, large muscles, or you're just doing some walking, or maybe you are doing endurance games. Volume, this is expended equivalent at least 1,000 calories per week. And progression, adjust frequency, intensity, or time until you reach your goal. So this is very important when you are making plans for your clients or even yourself. You also want to do resistance training, 8 to 10 exercises that condition the major muscle groups, flexibility training, static stretches, so that way you are able to manage your flexibility as you age. So health and fitness benefits of different amounts of physical activity and exercise. So if you're doing 150 minutes per week, muscle strengthening exercise 2 or more days per week. Sample activities would include doing yoga for 30 minutes or dancing really fast for 30 minutes. And health benefits would be better cholesterol levels, reduced body fat. If you're doing moderate exercise program, this is 20 to 60 minutes, 3 to 5 days per week. And then you're doing jogging for 30 minutes, 3 days per week. And all of the activities really help your lifestyle by improving physical fitness and improving your health and quality of life. Vigorous exercise. So this is 20 to 60 minutes, 3 to 5 days per week. You're running for 45 minutes, 3 days per week. And all of those exercises really help increase fitness and somewhat greater reduction in chronic disease risk. So guidelines for creating your own exercise program. Train the way you want your body to change. Train regularly, start slow. So you want to have the beginning phase, so body to adjust, progress phase, fitness increase, and maintenance phase. The target level of fitness is sustained over a long time. There is a condition as overtraining, so you could cause a lot of harm to your body if you're overtraining. So you do have to give your body time to rest. You want to have warm-ups before exercises, cool downs. As you can see, for next week, we will have a warm down, a main exercise, and a cool down in the instructions that will be presented by the groups. So you always want to be in tune with your body. So if something is not feeling right, you should stop. You want to vary your activity so you don't get bored, and train with a partner for safety. A lot of exercises come from discipline patience by training your mind. You need to make sure you're eating well, you are having somewhat of a fun, and you're tracking your progress so it can keep you motivated. Progression of exercise programs. So for example, here we have walking 3 to 4 days per week. Then we're doing walking and slash jogging. Then we're moving into jogging 3 to 5 days per week, 20 to 30 minutes. And then we're moving to maintaining 2 to 4 days per week, interval training. So you need to do it slowly by making sure that you're not overtraining also. So test your knowledge. Is it true that improving your